So last question I had, something practical to take away from the audience. We don't always want to talk about once we have cancer, what services are we able to provide, but providing education and knowledge base for prevention. And so I'm kind of going to leave that to an open book because they may select certain lifestyle choices or they may do it by cancer type. But I think that's something that everyone here can take away. And unfortunately, we see you often too late in the cancer center. And with population health and the way the healthcare is going, we really need to focus more on keeping you out of the cancer center. So I was just going to let them speak to the various prevention and lifestyle choices that can help you as you go out through life.
I can speak a bit about this. So, the best advice we do is don't smoke. If you smoke, stop. And if you don't start. So we see sometimes we also do blood diseases. So I see a bunch of patients who, because of smoking, they get, they don't have enough oxygen in their blood. So their body needs to make more blood. So they get thicker blood, so to speak. And that could cause problems. So we see them and I tell them, stop smoking because I also don't want to see you 10 years from now with lung cancer or with other types of cancer. So that's the best advice. Also exercise is good. And, it has been shown in a lot of studies that recurrences in cancer is less in people who exercise. And I always tell patients, exercise doesn't mean you're Lance Armstrong all of a sudden. So you can just walk. Early humans just hunted for food. So walking is excellent. Brisk walking, you don't have even to run, but just be active. Don't use the remote control all the time. Just walk inside the home. Any activity is good enough, actually, as long as it's persistent. So do every time, every day, 15, 20 minutes. You can escalate. It helps blood pressure, helps heart problems. The cardiologists will have less business if you do that. So that's probably the best advices, the exercise, the smoking. Obviously, there are some types of cancer that could be related to exposure to asbestos, which we don't really see that much, and some types of radiation, which we hardly see anymore. And staying healthy, eating healthier food too, that also helps. Generally speaking, if you stick with those, that's the best. We have also lung cancer screening, which for people who either quit smoking or are current smokers, they have been smoking for a certain number of years. There is a certain criteria that we apply. We could do a CAT scan for them, a CT scan with low-dose radiation, and see if they have any lung spots that look suspicious, need to be monitored, or that. That has been shown that you could pick up lung cancer in its earliest stages. And also it actually been shown that it helps people quit smoking, because if they have something on their lung, they're like, oh gosh, I don't want that to be lung cancer. I'm just going to stop smoking. So that's something that we offer St. Bernard's. We have a lung cancer screening program. And mammograms starting age 40 or sometimes younger, and colonoscopy starting at age 50. That's the best screening that we do.
A couple other things I'd like to push. The gastroenterologist, they always are stating that colon cancer, rectal cancer is entirely preventable. And the way we prevent that is by having colonoscopies and finding tumors before they actually develop. When they're early and just a polyp, like a little bump on the lining of the colon. And if we can resect those early on, then the cancer never develops. Another prevention, and this is somewhat controversial with the folks with vaccines, but the HPV vaccine for children can prevent future risk for cancers of the cervix in females, the penis in males, and other cancers. And you want to start it before they're sexually active. And so a lot of parents kind of push back. My child's not sexually active. Why would they need that vaccine? We're talking about a 9 and 11-year-old. But that's the time in life to get it, to prevent them from having cancer when they're 40, 50, and 60-year-old. So that's a real important thing that we can do for our children. No smoking, no tobacco in any way is huge. And again, live that healthy lifestyle, keep a normal weight. And mammograms for ladies, follow up with mammograms. And guys, if you feel a lump or a bump in the breast, you can get a mammogram too. It's possible.
Did you have something?
Well, of course I'm going to talk about diet, but they talked about being active and a big part of prevention also is weight maintenance, keeping your weight within normal limits or as close to that as you can come. And a lot of that has to do with diet. And so, typically, for prevention, what I recommend is to have a healthy, balanced diet. I don't know if any of you are familiar with My Plate. But it is the new dietary guidelines for Americans. The food pyramid has been redone, and it looks like a plate. It's a perfect example of what your plate should look like. Half a plate of fruits and vegetables, lean proteins, not eating red meats every day and doing more plant-based proteins, eating whole grains, and having low-fat dairy products. So of course, with that comes calorie limitation, making sure that we're eating the calories to keep our weight under control and preventing obesity. And exercise comes with that as well. It can help with that. But also, trying to also avoid, hyperglycemia or diabetes. So limiting your intake of highly concentrated sweets on a consistent basis. So that doesn't mean limiting them all the time, but maybe not having that cupcake every day or having dessert after every meal, so that we can keep our blood sugar within normal limits too.
Okay.
The only other thing I want to add to that, everything everyone said is exactly right. It's just making sure you see your primary doctor regularly and making sure you follow up with them, get your testing, make sure you're testing for things like diabetes and heart disease and things. In addition to they can coordinate your cancer screenings and things. It's very important. People think that either they're young or they don't have any health problems and they don't need to go, but that is the time to go, before anything happens, and they can provide you with a lot of the recommendations we sort of have here, and they can point you in the right direction if you have additional questions or things come up.
And I was going to mention what Dr. Cream was talking about with the low-dose CT. If you are at risk or do meet those qualifications by age, smoking, etc., you can get that referral for that by your PCP. So you don't have to have any medical symptoms going on. You just have to go to your PCP to get that referral, and he is correct. We do that at the St. Bernard's Imaging Center. So we do have that service available.